Okay, and I'd just like to introduce Cam, Cam Fraser, who is the chair of the board of the WMSC, and he will be introducing our speaker for this evening. Cam, over to
Thanks,
you.
Betty. That's me over here with the mustache. Well, we're very fortunate this afternoon, or I guess where you are, it's actually evening now, to have Catherine Caule speak to us today on a second opinions. Catherine is a long-term lymphoma survivor and a member of the Lymphoma Support Group of Ottawa. For 13 years, she was a management consultant who helped federal departments improve financial and management services. In 2000, her life changed when she was diagnosed with advanced Hodgkin's disease. Catherine has reinvented herself as an advocate for the health of individuals and communities. She has served as board chair of Centretown Community Health Center. She was also appointed to the City of Ottawa's Health and Social Services Advisory Committee for a 4-year term. She was chair of the Health and Social Services Committee of the Glebe Community Association. She also served on the Champlain Regional Cancers Program Patient and Family Advisory Council for 9 years, sitting as vice chair for the last 3. Catherine was a patient advisor for 3 years on committees at Cancer Care Ontario before appointment in 2017 to its board of directors. She has been a board member of Little Angels Blood Cancer Fund and 2 figure skating clubs in the Ottawa area. Catherine is a lector at her church and a figure skating judge. Catherine, we welcome you to the WMC National Zoom meeting and look forward to your talk on second opinions.
Thank you, Cam. Also, thank you to Betty and Ray for the invitation to speak to your community on this important topic, and to Dan for his technical help with this presentation. And as Cam said, this is a very important topic for patients because never before have we had access to the reams of health information at our fingertips. And a little factoid that Google receives more than 1 billion health-related searches per day, which boils down to about 70,000 per minute, according to Becker's Hospital Review. And people are asking about conditions, symptoms, medications, and medical coverage. So it's not surprising that patients are seeking second opinions more and more. Next slide, please, Dan. Okay, thank you. So next slide. Thank you. So I've opted to change the title of tonight's presentation from Getting a Second Opinion to Navigating Second Opinions, because numerous variables come into play in how to get a second opinion and what kind, because there are so many different kinds of second opinions. And these variables include our desire or need, our health status, the particular health issue, our relationship with our doctor, and the time and financial sources available. So second opinions and the process of getting them are very personal, and what works for one patient may not work for another. There is no prescribed way to get and use a second opinion, and the process is fluid, and so it's better to conceptualize the getting as navigating the process. All that being said, we can do many things to move our boat along smoothly. Next slide, please. Tonight's presentation is not my opinion. It's a patient perspective that's informed by input from 15 clinicians and health practitioners, including 5 hematologists, 4 other specialists, 3 GPs, and 2 social workers. Also, some Waldenstrom's and lymphoma patients who have explored or obtained second opinions. And I'd like to thank those Waldenstrom's patients who submitted their feedback on second opinions, and also informed by the Ministry of Health of Ontario. Also, I looked at web literature reviews and second opinion service reviews, had many chats in 2021 with intake staff at US entities offering reviews and or second opinions. And also a big part of this is my own experience with getting second opinions. But I'm neither providing medical advice nor endorsing a specific service or pathway. There are 3 basic questions, next slide please, that we'll explore tonight. Can I get a second opinion? when would I get a second opinion, and how and where would I get a second opinion? Next slide, Dan, please. So the big question of can I get a second opinion? The answer is yes. Both the Canadian Medical Association and OHIP, for the case of Ontario, are in the patient's court regarding second opinions. The Code of Ethics and Professionalism for the CMA articulates that the physician and patient have to engage in shared decision-making, and very clearly states that the physician should respect the patient's reasonable request for a second opinion from a recognized medical expert. And the physician code in Quebec also stipulates in brief that the physician must acknowledge the patient's right to consult with a colleague or another professional. And in Ontario, OHIP does ensure second opinions, and it seems to be the case, though I'm not as familiar with Ontario, for British Columbia and Alberta. And if you do have a question about that, it's best to contact your provincial health ministry. In the US, the patient does have the right to a second opinion, but patients have more autonomy in that they don't always need a doctor's referral. So the bottom line is we can get second opinions in Canada, but we need referrals from a doctor for in-system referrals to specialists. Now, there is an exception, I know, in Ontario, which is if you walk into an urgent care center, it could be a source to get a second opinion, but the doctor doesn't really know who you are or what your situation is. But there may be an opportunity to use an urgent care center as a sounding board, but I would call it maybe a lower down on the option benefit list. Next slide, please. So at the clinical level, when would you likely not get a second opinion? For a life-threatening emergency situation, because there isn't time, and you should just understand that there are second opinions among doctors. So my husband had a pulmonary embolism that brought him to the emergency room. And one option that was discussed was giving him a clot buster, which could have the effect of a brain bleed and send him to the ICU, versus another doctor who said, let's keep giving him blood thinners and see if it brings down his heart rate and stabilizes him. So I'm very fortunate we went with the more conservative opinion. Also, acute situations like a burst appendix, you need to deal with that immediately. Certainly minor issues and everyday healthcare where it's a differential diagnosis by your GP that's going to narrow down your problem. So when would you consider a second opinion? Certainly for Waldenstrom's and other rare diseases, you would want to consider a second opinion. And in North America, only 4 people per 1 million are diagnosed yearly. In Canada, that's about 150 a year for a total number of patients of about 1,500. So that means that generally a physician may only see a newly diagnosed patient with Waldenstrom's every 2nd or 3rd year. So practitioners may have limited hands-on experience with Waldenstrom's patients. Serious and chronic diseases certainly would be another situation. Things that would affect your abilities in the longer term, any unexplained medical issue, continuing or worsening symptoms, risky treatments. And if you're, in the position where you're dealing with solo practices or small centers, which may not have the advantage of practice teams that an academic hospital might have. But the bottom line is, if you're comfortable with the diagnosis and the proposed treatment and the doctor, you don't have to ask for a second opinion. Next slide, please. So that was the clinical level, but at the person level, it's much more fuzzy, but there are good reasons to get a second opinion in that case. The short answer is if you or your family think you need one, then probably you do. And you should get it as soon as possible. In my case, I had a late stage and relapse disease. And I wanted to get the best possible health outcome and quality of life. I wanted to live as long as possible and enjoy that time. I wanted to know what my treatment options were, because when I relapsed, the doctors gave me the option of high-dose chemo and an autologous stem cell transplant. I did not like that option. I feared that option. I did not want to hear about that option. And going through my initial treatment, it was my worst nightmare that I would relapse and need a transplant. In the moment, I couldn't appreciate that the doctors telling me that I had an option for a transplant and therefore a cure was a good option. I wanted to know what else was available. And given the risks of that option, I wanted to avoid a mistaken diagnosis. So I wanted to make sure that I had a confirmed relapse before having a transplant or any other treatment. And getting peace of mind. You need to be confident and trust that it's the best decision for you, not for your doctor, not for your family. And certainly avoid the regret of I should have, because regrets about the road not taken can result in resentment with your care team and with yourself, and possibly can compromise your outcome. And my initial lymphoma diagnosis and its recurrence turned my world upside down. So it was a time of uncertainty for survival, finances, and relationships. I wanted a sense of control, and I felt that getting more views would reduce my fear and anxiety. Next slide, please, Dan. Here's a few slides that deal with some context, because there are many things that go on before the patient gets to the table with the doctor. Clinicians generally consult with each other and exchange opinions. GPs, they often make differential diagnoses and see how a patient responds to a treatment. And then they may refer a patient to different specialists. And when you have those referrals, in effect, they're getting a second opinion. And I'd only caution that it requires patient vigilance on the part of the GP to keep going through the process. And it also requires the patient to be vigilant in reporting back to the GP if something isn't working for them or if the referrals are delayed. And that, in fact, was the trigger for my whole journey. There are tumor boards and multidisciplinary cancer conferences that are meetings of specialized doctors and other healthcare providers who gather regularly to discuss new cases or unusual and challenging cases. And they decide on the best possible treatment plan for a patient as a group. And your case might be discussed if you have a less common type of cancer or one that doesn't have a standard course of treatment, or if your treatment isn't working the way it should. It's a way to give the doctor multiple second opinions instantly. And usually the doctor that has seen the patient in consultation presents the case and the proposed treatment options. And then there's a discussion about the possible treatments and a consensus among the group for the best option for the patient. But ultimately, the treatment recommendation rests with that doctor. Here in Ottawa, the blood and marrow transplant program has disease groups and new cases rounds that may occur at many academic centers. Pathologists will share their pathology impression with their colleagues before it comes out on a report to you. There's monthly pathology rounds to review cases when a patient's clinical signs don't match the pathology impression. And general pathologists at community or smaller hospitals will generally send an impression to a consulting hemopathologist and an academic or bigger center. And doctors may phone each other. So basically, a lot of eyes have seen our cases before our treatment options are presented to us. So you may want to ask your hematologist or oncologist if your case was discussed at a tumor board or multidisciplinary cancer conference, or if your pathology impression was reviewed by other pathologists. And frankly, nothing stops you from picking up the phone and calling the pathologist whose name is on the bottom of the report. They're used to this and it happens all the time. Next slide, please. So with so much health information in the hands of patients, it's not surprising that second opinions are big business. People want second opinions, and the market is stepping up to meet that need. We should not feel shy about asking for a second opinion. And Dr. Mary Kwok of the Hutchinson Cancer Center in Washington reported to participants in 2022 at an IWMF virtual presentation that oncology has a high rate of second opinions, with between 6.5% to 36% of patients seeking a second opinion. And the overview is that the landscape has changed so much in 20 years. When I was going through the process, the internet was just becoming mainstream, and basically it was an old school way. But now, with the virtues of technology and the increase in patient medical consumerism, the projection is a 5-fold increase in the market for second opinions over 5 years. And one of those drivers has been COVID, which has brought telemedicine and virtual appointments into the mainstream, and they're more accepted by practitioners and patients. So the market for second opinions, are hospitals, insurance companies, and online services. And there's going to be more and more online services. And North America and Asia are the key areas of growth. But looking at this, there's huge potential for health inequities. In-system opinions, that means getting it through your provincial health authority, for example, are free of charge, but there may be a wait time. Most out-of-system services charge a fee, and quick second opinions come with a price tag. So if you can't pay or don't have health insurance, you will not have the same access and possibly could have a suboptimal health outcome. So are second opinions a privilege for the affluent? We're not going to answer that today, but just putting that out on the table. Next slide, please. So physicians can do nothing for a patient without valid consent, and this is called informed consent. It applies to operations and all forms of medical treatment and invasive diagnostic procedures. And it's always in play unless there's an unquestionable necessity to proceed at the time, such as at an emergency, okay, or if there's an imminent threat to the patient. Then the doctor does what's necessary without consent. But for consent to be valid, it has to be informed consent. And as patients, we have been given an adequate explanation about the nature of the investigation or treatment and its anticipated outcome and the significant risks involved and the alternatives available. It's not just about a piece of paper. It's about an explanation given by the physician, the dialogue between the physician and the patient about the treatment. And that's the all-important element of the consent process. So the takeaways are, as patients, we can't give informed consent without knowing the alternatives, and there are always alternatives. Patients, when they give informed consent, buy into the treatment, its upside and its downside. And a patient wanting a second opinion on the treatment options does this before giving consent. Next slide, please. So where we get treatment is dictated by what is offered at particular institutions and by practitioners. So specialists will only propose their treatments. So when we look for a second opinion, we need to target the request to the right specialist. We want to make sure they're not biased and have the patient's interest in mind. So I wanted to know whether radiation was a viable alternative to stem cell transplant. The radiologist told me that it was an option for me and discussed its pros and cons, but ultimately told me that it would not give me the remission I could get from a transplant, and I'd be back in for more treatment in a few years, which would likely be a transplant. And I appreciated his candor and lack of bias. And hospitals will offer treatments that its clinicians know. So if you're looking for a particular treatment, you have to go where it's offered. And also, clinicians will not support treatments more often than not that are offered elsewhere. So I had thought about going to Toronto for a particular kind of chemotherapy treatment, but then I was told by the doctors here in Ottawa that no, since they don't offer that, they wouldn't support me for any side effects or complications or anything I had as a result of that treatment. And that would have meant having to go to Toronto to the emergency room there or Princess Margaret Hospital every time I had a little issue. If I spiked a fever, I'd have the 5-hour drive to Toronto. And blood cancers are increasingly becoming a chronic disease with intermittent periods of remission. So we have to keep in mind that we will need the doctors and the team's care for a long time. Treatments may give us a few years of remission, or we might be in active surveillance, but at some point we may need to get treatment, and we need to think about how is that going to play out if we decide to be treated in a center far from where we live. So if I had the transplant in Toronto, would I be going there for follow-up visits, or if I went to New York for a second opinion, would I be traveling there for follow-up appointments and possible retreatments for years? So we have to be clear in our mind when we go to a center, are we going there for the second opinion, or are we looking down the longer horizon? Because there's lots of factors that come into play. And we want to make sure that we have a doctor who's a partner with us, because we may need their help for other things along the way, like completing forms, helping get referrals to other specialists to deal with other symptoms. So we need to know what's offered at that institution, and are they really a partner with us for the long haul, or just to give us a second opinion? And different centers view the world differently. So when you get a second opinion, a treatment option that may be proposed, for example, from the United States, may not be available here, or it may require an approach that doesn't really work for you. So, for example, at Princess Margaret, the transplant was a viable option for me, but it would mean 20 days in isolation versus in Ottawa as an outpatient and staying and recuperating at home. So we really need to know where we are, what our preferences are, and what might work with us in the short term and the long term. Next slide, please. COVID-19 was a big driver in second opinions, and it's negatively and positively affected our ability to get them. It's taking much longer to get an in-person appointment because of stretched resources and backlogs. And even I've been told that the US centers, the time frame to get opinions are increasing as hospitals resume pre-COVID activity levels. So telephone consultations and virtual meetings are now popular with doctors, and if you don't need a physical assessment. So Zoom meetings are a great way to have face-to-face contact with a doctor. They're easy to arrange and save on travel costs, but they're not so hot if you need a physical assessment. Also, as a result of telemedicine and virtual consultations, some platforms allow you to upload the pertinent medical records and even scans. This is a heck of a lot easier than getting a very, very large film and putting it in a portfolio and carrying it on an airplane and hoping that it doesn't get lost in the process. So the question I'd ask about the wonderful new world of virtual meetings is, if you need a physical exam, how long are you able and willing to wait for a second opinion? And will a virtual discussion meet your needs? Okay. And the key players in second opinions, patients and doctors, we can each impede our ability to get our optimal treatment. As patients, we can be reluctant to ask for a second opinion so we don't offend or anger the doctor and risk getting less care. We may project that the doctor will interpret our request as a lack of trust or confidence. And some of us may not be comfortable with questioning people in positions of authority. And doctors may have a mindset that similarly educated, trained colleagues should arrive at the same conclusion, so why bother? They may have some discomfort and or inexperience with someone without medical knowledge or training, i.e. the patient, questioning their recommendations. And they may also project that because a patient is unwell, they're not in a position to travel or do the extra work of getting a second opinion. So ultimately, to navigate second opinions and get the answers you seek, you have to communicate effectively with the doctors. And over the course of 4 years, I got a dozen second opinions of various kinds. And I was very fortunate that along the way, all of the doctors supported my request for second opinions to help me make a decision and have my confidence and know that once I made the decision, it was the right thing to do. Next slide, Dan, please. I've highlighted this slide in orange because it's an important question to ask yourself before proceeding on your second opinion journey. Why do I want a second opinion? We should always be asking that. Why do I want it? Second opinions are not without risk. In fact, at the end of it, you might end up more confused and not be able to sort out the information. We are patients with medical conditions. Time is precious and energy is scarce, and not all whys do merit a second opinion. So I'll just go down here. Unsure about a diagnosis. Do you have a pathology report? Is it definitive? Do you understand it? Do you have the imaging or the appropriate blood and laboratory tests done? That probably could merit a second opinion, or at a minimum, a second discussion with your doctor. You're unclear about how well a test or treatment may work. Well, did the doctor explain it fully to you? Have you done your own research? Can you just go back to the doctor and ask for more information? You need information about other treatment options. Well, certainly you need to know this before you can give informed consent. And did the doctor tell you how he or she arrived at the option? Did they say what other options he or she considered? And if options were ruled out, why? You want to end up with the list that you can then rule out options together. It might be financial, it might be time, it might be travel, but your goal should be getting all the options on the table so that you can make the decision. I don't understand something, so should I get a second opinion? Well, basically, have you asked your doctor to explain it? And a big one is fear of the treatment, dying, effect on the family, effect on the quality of life. Yeah, maybe you want to go through the second opinion process to gain confidence, but there are also other discussions you can have with people who are not clinicians. And the final one, don't trust the doctor, don't like the bad news, looking for the answer I want. That's probably not a good reason for getting a second opinion, because getting the answer you want is not optimal, basically. So let's talk about communication on the next slide, Dan, please. So a medical or second opinion versus a second conversation with your doctor or a social worker or a counselor or another health practitioner may solve your need. So you need to assess, do you truly need a second opinion, or do I need to talk to someone else first before making my decision? Okay, the options or the opinion doesn't resonate with my preferences and values. I'd suggest that, maybe that conversation comes early on, or you go back and tell the doctor about him if you haven't already. Let's face it, they just met you. They don't have a sheet saying this is the background and preferences and values of Catherine or Mary or Fred. So there's conversation required here. My family wants a second opinion. Okay, I'm not able to afford an aspect of the treatment. That's possibly going to a social worker. How will it affect my family? There are ways to talk to other people who have gone through the same treatment, looking at resources that have peer support who could help you with that, support groups, websites. Just not everything has to be directed to the doctor. Verbalize what it is you need and why. This is very, very important because your ask will influence whether you need a second opinion or direct you to who you need to talk to. And if you do need a second opinion, you need to know what information you're asking about. Online second opinions have limits on the number of questions you can ask. So, you need to boil it down. I'd say no more than 5 specific questions, even less. Bring someone with you for confidence and to take notes if you do have a second opinion. And ultimately, the conversation doesn't end when you say to your doctor, I'm getting a second opinion. The onus is on the patient to go back to their doctor to check back in when you have gathered the information and discuss. You need to close this loop. This goes back to the notion of informed consent. And also the trend these days is for shared decision-making between doctors and patients. Next slide, Dan, please. So here's my top tips for communication. Honesty is the best policy. Don't blindside. Tell your specialist or the oncologist you're dealing with if you're getting a second opinion out of system or a virtual opinion that doesn't require their sign off. Ultimately, word may get back to them, or the consulting doctor may need to ask them some questions. This doctor needs to know what is going on, and you're still their patient until you make a decision to be treated elsewhere and perhaps move your care elsewhere. And you certainly don't want to burn bridges because our diseases tend to be long-term. Our health journey will last a long time. And second opinion consultations should be seen as rest stops along the highway, okay, not the destination. We expect our doctors to be polite and respectful when talking to us, and the same should go for how we talk to our doctors. Consider our doctors as our partners, not as our adversary in our health journeys. And all relationships have bumps in the road, and you need your doctor for a long time. If you absolutely can't get along, think about finding another doctor, but that's not without its own set of problems, especially in an era of resource shortages and system backlogs. Practice your ask with your friends and families to get confident before bringing it up with your doctor, because practice will make it easier, and you'll be more confident in how you approach your doctor and why you want the second opinion. You can also prepare a list of potential doctors and centers, keeping in mind budget and time constraints. Don't ask for a second opinion at a facility in the United States that may cost $8,000 if you don't have the budget for it. Be reasonable when you prepare your list, but you may get a consultation faster from someone that your doctor knows. And consider asking your doctor for the name of another expert, someone with whom they're not closely connected, if you are concerned about bias. And the IWMF has a directory of cancer centers and physicians that you can consult. It's on the website, you can print it off. And also the WMFC has excellent pages on contacts for obtaining a second opinion in Canada and the US. So these websites are excellent resources for starting your short list of second opinion professionals. You should also think about making a list of potential clinical trials. There is a website with the list of clinical trials in the United States and Canada, trials that are actively looking for patients. So that should be reviewed, and perhaps Betty or Cam or Ray might want to look that up for me, please, and post it on the chat. And as I understand, clinical trials are a key possible treatment option for Waldenstrom's patients. So this is an important list to start doing. You know, let's show our doctors that we're proactive, that we're an equal partner in this whole decision-making process, and help do some of the work to get the conversation started, okay? I really have to say, often the onus is on us. And if the patient is not in a position to do this, then perhaps a trusted family member or friend could work with the patient to help pull some of these lists together. You know, something we may not think about, but I realized was very important, was to prepare a medical history script that you can use for second opinion consultations and other referrals. I told the same story at least 3 times. If it's written, it'll be consistent, and it should include details of your current problem, timing, when it started, locations, symptoms, any changes in symptoms, worse, better, and some of your past medical history, including meds, and if you want something about you, some socio-demographic information like marital status, any job or career you had, your hobbies, etc., your family information. It's good for you to write this down. It's good for you to have this so it's clear in your head, so that you can present it to the people you speak with, so that it can be uploaded on some of the virtual websites. And I would suggest that you give it to family members who have been with you during your pre-diagnosis situation, to review it and make sure all the information is there, because you want to be as thorough as possible. It's not going to be the same perspective as what the doctors are providing. It's kind of like a mirror image, but it may have more information than the doctors may have included, because let's face it, when we talk to doctors, we're under stress, we forget things. So putting it in writing is a good exercise. And also can think about running it by your GP to make sure that it's clear and thorough. You're going to have to think about defining the criteria for how you're going to assess the treatment options that you're going to collect from all of the second opinions. It's best to do it ahead of time rather than after, because this will make the job easier and avoid some of the confusion. And also, you may want to think about defining some of the criteria for assessing the quality of the second opinions, because in this new age of computers and automated information, there's going to be differences in the quality of what you're going to get and the appropriateness of what you're going to get. So think about that criteria ahead of time. Talk to your GP and keep them informed through the process, because they are a key partner throughout. Your GP can be a sounding board for the proposed diagnosis and treatment, which may eliminate or confirm the need for a second opinion. And they can help you along the way getting a second opinion, and help you make sense of the information you need so you can make a decision. So one of the things I did was I sent my pathology report and my slides to the United States, to the National Institute of Health, to get a second opinion, because the diagnosis was on the, or the conclusion, impression, whatever you want to call it, was on the fence. And so that was a situation where they needed a doctor's authorization. But so I went to the GP to get it, and obviously explained to her why I was looking for this consult from the United States. So they are partners with you in this journey. And even when you're seeing the specialists, if you're new to this process, it was certainly new to me. I didn't realize that my GP was still going to be involved for other health matters, physicals, routine screening. And always make sure that your GPs get copies of the second opinion reports. Typically, your consulting doctor will write up notes and send them along to the doctor who requested the second opinion, but you should always make sure that your GP is copied, and also to try to get a copy of it yourself. And, you know, take your life partner and family with you on your health journey, and that includes on your second opinion journeys. You rely on them, so they need to know what's going on, and they're going to be affected by your decisions that will arise from the second opinions. So maybe they have a perspective. And on the other hand, maybe you're doing all this to satisfy them. So you need to talk it out. So next slide, please, Dan. We find that, you know, communication is critical, obviously, in getting a second opinion. And if you still feel you need a second opinion, you need to tell your oncologist. You're a partner with your doctor in your journey, and take this opportunity to show that you value your relationship with your doctor and his or her views. So the hardest part is asking for the second opinion, but, you know, develop your questions in a way to work together with your oncologist. I've put down here 8 or so ask suggestions that I collected from numerous publications. They're out there in numerous websites. Just say, asking your doctor for a second opinion, and all kinds of pages will show up. But the gist is to find a way to work together with your oncologist, and so involve them in this asking process. So if you had my type of cancer, who would you see? Or, I'd like a second opinion. Would you be able to help me with that? Or, I respect your opinion, but it's important to me to consult with another expert so I'm completely confident in our treatment plan. The words are important. The partnership is important. Ultimately, the bottom line is you need to be sincere, but be sincere and be inclusive. Next slide, please. Okay, so know before you go. It's kind of like the GPS of getting a second opinion. Navigating second opinions take energy and may move you out of your comfort zone. So if you choose to ask for a second opinion, ask your doctor about your time window for making a decision, and if there are any risks to delaying a decision while you gather more information, if it comes to that. This answer may influence what kind of second opinion you seek. So if you have a window but don't have a big window, waiting 3 months for an in-person appointment at Princess Margaret Hospital may be off the table, but perhaps a phone consultation may be better, or some kind of online approach may work. Or perhaps that doctor has a friend or a colleague that you could at least speak to first. Certainly, if you have situations like hyperviscosity, as I understand is a condition that you can get with Waldenstrom's, that will influence your time frame for making a decision. So what budget do I have? Do I have the money to do the traveling, to stay in a hotel, to pay the cost for an online second opinion? We're not talking about pennies here. Some of the ones from the United States can be upwards in the high hundreds, if not thousands of dollars. And what is my available physical and mental energy and stamina? And also, how comfortable am I with being assertive? So know this before you proceed down the road. And you will ultimately have work to do to get a second opinion and to navigate second opinions, unless the opinion is something like a phone call to a consulting physician. You will have to get documents, you will have to get scans, you will have to upload it possibly. Are you up to that? And be clear on your resources ahead of time, because that is a key driver in how many and what second opinions you will get. Clarify the what's of your requests. I alluded to this earlier. What is it I want to know? Name that down, drill that down to 5 key asks, okay? You don't want to go second opinion shopping. You don't want to go answer shopping. What is it that will help you make the decision you need? What kind of second opinion do I want? Do I want a face-to-face meeting? Do I want a thorough second opinion where I'm going to end up getting a battery of tests, perhaps some that I've had already here in your town or in our country? And what caliber of second opinion do I want? Do I want to go to a professional who could be recommended, for example, on the directory of Waldenstrom's physicians? Or do I want to go to more of a, we'll find someone to give you an opinion and you'll get the result on the computer electronically? We are dealing with a new world of second opinions, and caliber is an important consideration. And certainly, if you've answered the question that, yeah, maybe I want to get a second opinion and maybe go get treatment with that person, the caliber of the second opinion will come into play. So it's not that these aren't licensed doctors or excellent professionals, but let's face it, they're looking at some tests that are sent by computer in many cases. So they've never really had a chance to meet you, talk to you, nor have you had a chance to talk to them and find out if this is a doctor that you can work with. Find out who can help you, because you might need to make travel arrangements, handle collecting and delivering required materials, do some basic research. This is an iterative process, and you may need to do this a few times. So navigating this will require your commitment. Next slide, please. So the world has changed a lot since 2004, when I last got a second opinion, and there are so many virtual options now. So I put together a quick sampling of second opinions that are out there now. I I did a search, I made phone calls, etc. Some of these you can request directly, others require a physician's referral. Some are free of charge and some require costs. So you can get second opinions on your pathology. You know, you can call the pathologist on your report. That doesn't require a lot of information. You can ask your clinician or GP to find a pathologist. You can even ask the chief of pathology at the hospital to look at the report. Okay. If you have a pathology or that's on the fence or that has diagnostic difficulties, you could ask a doctor to send a request to the National Institute of Health hematopathology section in the United States. That is free of charge, except for the cost to ship some of the slides that they need. You can request a pathology second opinion from MD Anderson Cancer Center in Texas. And depending on the complexity or if more work is involved, it can be as inexpensive as $272 or up to in excess of $3,000 US. Next slide, please. You know, radiology, again, it's the same thing. Most efficient and optimal way is to ask your GP or clinician to find a radiologist who can give a second opinion. You can, in Canada, we can ask our doctors for a second reading and opinion on CT and MRI scans from Second Radiology in Toronto. That's free of charge. That is one source that my recollection was paid in Ontario, certainly by OHIP. You can get an imaging second opinion report of all kinds, CT, MRI, nuclear, PET CT, ultrasound, X-ray, from an organization called Second Opinions, which is in the United States, for $300. Now, there's many more of these. This is what I could research in a short period of time. For hematology questions, again, you could get a hematology second opinion from this organization called Second Opinions. You can either get a written report or a phone call from the $300 to $700 US. Next slide. You can get a second opinion consultation with a specialist at Princess Margaret Hospital if you're in Toronto, and I apologize to listeners, participants who are out of Ontario. I do not have the other information on similar institutions in your provinces, but this is just an example. And if it's in province, usually it's free of charge, but you will have to pay travel and accommodation if it's in person. You can request an in-person second opinion consultation at Memorial Sloan Kettering Cancer Center. That may cost you greater than $4,000 US plus your travel. And you can get a remote second opinion, which would be a pathology review, a radiology review, and a video or written consult that you could have available as a package or a la carte, which can be anywhere from $2,750 US to $4,000. You know, the world's your oyster. A lot of these US institutions have concierges that the patient will deal with. They'll provide triage. They can even sometimes help make lodging recommendations, but they will navigate the process with you. So this is out there because of the demand for second opinions, that people are there and willing to pay the money. Next slide, please. Here's universities, medical schools are offering remote second opinions. I'm an alumna of the University of Chicago. I Googled that. Yep, I could get a written report and a debrief phone call for $750 starting fee. I can request an in-person second opinion consultation at the Mayo Clinic in Rochester, Minnesota, which I was told would cost around $7,000 plus travel and accommodation, or I could get a virtual second opinion for somewhere between $500 and $1,000. Another medical school, Stanford, will give second opinions for $700 US with possible extra costs. For Waldenstrom's, and these were clearly outlined on the website for WMFC, Dana-Farber. There's through partnerships with Dana-Farber, you could get an online second opinion for $2,400, or an in-person second opinion that's likely more than $2,400. But they are there and very familiar with the Waldenstrom disease and impacts on patients. And also the Mayo Clinic has similar options. And the website clearly identifies a contact you can speak to start the process. Next slide, please. Some things, we can have phone calls for initial assessments with things that are covered by health insurance. Would I go to MD Anderson? Perhaps, but I was told that you could get an in-person second opinion with a full evaluation of diagnostic tests, blood work, pathology, and consultation over a 7-day period for $50,000 US. And some of the resources we don't think about that maybe we have available to us are expert medical opinions from second opinion providers that are available to employees of enrolled employers, and also enrollees of private health plans such as Sun Life Personal Health. I never thought of it before. Maybe it wasn't there 20 years ago, but those don't cost any money, to the best of my knowledge, if you're enrolled. And Best Doctors is a big organization which will include an analysis of medical data with that might include diagnostic imaging, test results, and pathology samples. So look at your employee benefits packages, or your retirement packages, or your insurance packages, and see if there is an option for expert medical opinion. And the same thing with another organization called Medical Second Opinion, if you have insurance coverage with them. So there are partners with insurance companies. Think about that. It's very easy to get, and you may not have to go through a lot of the hoops. So those are the options that are out there. And the question, next slide, please. How and where to get a second opinion. Some considerations. I just showed you, I don't know, maybe 25 different options for different situations. That's only a fingerful of what's out there. But we should be asking ourselves, am I okay with an opinion from a doctor who has no potential responsibility of care for me? That's going to be the situation with some of these virtual or online opinions. From a doctor, am I okay with getting an opinion from a doctor who has not spoken or met with me? Am I okay with an opinion that includes AI generated information? Am I okay with an opinion that will include treatment recommendations that I can't get here, particularly if you send it to US-based resources? And am I okay with an opinion that doesn't include a physical examination? And do I really know who is giving the opinion? It's one thing to say that you're going to get a second opinion from XYZ institution, but who are the doctors at XYZ institution that are going to give you the opinion? You don't really know that. from what I can see, you really can't select most often who you're going to get the online second opinion from. And do I care if they've had 20 years of experience, 5 years of experience, located in North America, not located in Canada or the US. These are all things you need to be comfortable with. And am I able to ask additional questions? So what I've seen in looking at some of this online second opinion options is that you're limited perhaps to 5 questions. And if you want to ask additional questions, it may involve starting a second opinion all over again at another cost. And the person who replies to you may not be always the doctor who signed their name at the bottom of the second opinion report. So inevitably, in my experience with second opinions, each second opinion raised more questions from the ones that I went into with. So, keep that in mind when you check out the sources that you want to consult. So the bottom line in considering where to get a second opinion from is, what providers and information sources do I trust? Okay, and I can't emphasize enough that trust is the key word in the relationship with your doctor, in assessing the information you have, and in continuing through this journey. And it's really a predicament we're in, because we're thrown into a meeting with a doctor who we've never met before. And trust is the fundamental building block of the doctor-patient partnership. I don't know about you, but I generally trust people as I get to know them and go along. So, it is a dicey situation to be in, and maybe jumping to conclusions on 1 or 2 meetings with the doctor may be premature, but you have to be able to feel comfortable with your providers and information sources to make your decision, and also to travel along your journey. And I'm going to close on the topic of trust with my experience. So next slide, Dan, please. I've highlighted a few things in red here that ultimately come into play and are part of this whole trust factor. In my situation, over 4 years, I got a dozen second opinions from diagnosis to completion. And everything starts with our GP, because we know that the GPs are the route to the specialists. And if our GP isn't listening or isn't proactive, it can be a problem. And you'll never get to a specialist if the GP isn't on top of things. And unfortunately, I did not have that trust in the whole process when I went into this, because I had a very poor experience before I was even diagnosed. And as a result of that poor experience, I lost trust in the whole doctor-patient partnership and the healthcare system. And that was a driver, in my case, for many of the second opinions that I sought. Okay, so I questioned everything. And maybe it's my nature, but that's what happened. Just in a nutshell, I had symptoms that got worse over 2.5 years. Some of these might sound familiar: fatigue, cyclical fevers, chills, drenching night sweats, an elevated SED rate. My ask was, what is my diagnosis? So I requested a referral to a specialist because it had fallen through the cracks. And I consulted an online symptom checker to identify some possible diagnosis. I got my own second opinion, WebMD. And I was told, the system told me it could be either sarcoidosis or Hodgkin's disease. So right off the bat, I felt I wasn't listened to, and everything worsened. When I went through treatment, after much relief, I was told, based on imaging, this is 2 years later now, that based on imaging, I should go into high-dose chemo and an autologous stem cell transplant, but I was completely asymptomatic. So there, I didn't have trust in the imaging result. So was the lymph node change a true relapse? So I requested a PET scan that would help determine if I was a victim of scar tissue or active disease. And I won't go through all of these except to say that, the trust was important because I needed to know that I, in fact, did have relapse disease because I was asymptomatic. I was asymptomatic and being told that I had disease when before I was very symptomatic. And frankly, my pleas for getting something done were gaslighted. So that's the context behind why I got a dozen second opinions. And in your leisure, if you care to, you can go through all of those. Ultimately, I did go to Princess Margaret Hospital and Sloan Kettering, and they gave me the exact same, those hematologists gave me the exact same treatment recommendation as the doctors here in Ottawa, which was high-dose chemo and a stem cell transplant would give me either a cure or a durable remission. But the difference was that the two facilities with whom I consulted said, don't do anything until you get a confirmed relapse. Get a biopsy, make sure there's clinical signs and get a biopsy. So that was the twist. The treatment was the same, but the when was completely different. And those two opinions, which I'm very happy to say, were in agreement. So when I had clinical signs and when I had biopsy results, which I did get, I went into treatment for high-dose chemo and a stem cell transplant, knowing that it was the right thing to do. And with that confidence in the diagnosis and the proposed treatment plan, I was able to take comfort and have one less thing to worry about during the treatment. And I believe that the second opinions were a key factor in the outcome that I eventually, happy to say, had. And this is now 16 years later, and I'm here to share my experience with second opinions with you. So in closing, the last slide, Dan, please. This is your life. These are your decisions. And, they're not anyone else's decisions. They're yours. They're more important than a car. They're more important than repairing the plumbing in your house. You need to do your due diligence and get the information you need to make a decision that you are comfortable with, and then proceed to the treatment that is right for you. So thank you and stay safe.
Thank you so much, Daniel. Thank you for doing the slides and all you do for the WMF when it comes to technology. And Catherine, thank you for sharing your personal experience with us and navigating us through this very thorough presentation on all aspects of navigating second opinions. You did it so well that half the questions on my sheet you answered or more, 3/4. So I'll ask the few that are left. Thank you so much. One of my first questions that came was one of the best times to ask for a second opinion. You kind of touched on that because you did so many through your journey. I had written down, do you ask when you're close to treatment, a diagnosis, when you've undergone treatment and your symptoms are still there, or when you relapse? But it sounds from personal experience, any of those times are acceptable to ask for a second opinion?
Yeah, Ray, I'd have to say that's the case. Certainly if you're newly diagnosed, you'd want to consider a second opinion. Certainly if you relapse or something has changed, that would be a good time to ask for a second opinion. But really, if there's any kind of recommendation that you're not comfortable with, for example, I don't know how I would handle watch and wait. Am I the kind of person that would find it incredibly stressful to deal with the uncertainty over another, half a dozen years before longer before something happened? I'd want to know, is it a sound recommendation? And also, just sometimes you just feel you need to get it because there's something that's new or changed in your journey that triggers you to ask for a second opinion.
That's great, thank you. And
Also, if you've heard about new treatment modalities that are coming along the road, you might want to go back and ask someone, at this point in my treatment, is this something that I can consider?
Okay, excellent. And then if anyone else has a question, please feel free to type it in the chat and then I will read it to Catherine for you. Because WM's so rare, sometimes what's the best way to suggest to a doctor who does not have many WM patients resources that they may want to look at? How do you present that to them?
Well, this is a question that I asked 3 or so hematologists in the area here about. And I was surprised that some of them said, well, even at a large center, we don't see that many cases anyway. Mm-hmm. I'm reporting back what I was told by the clinicians as opposed to my opinion on this, which I'm not familiar enough with the disease or how to go about it. But I was informed that there is a standard protocol that is out there for hematologists to refer to for treating Waldenstrom's and side effects, etc. Most doctors are familiar with managing. I was also informed that there is a resource that doctors can have, a doctor-to-doctor consultation. Dr. Castillo, I believe, I forget what hospital he's.
Dana-Farber.
Dana-Farber, thank you. If you encounter a practitioner who's not as familiar with Waldenstrom's, he will provide a consultation and provide a second opinion free of charge, doctor to doctor. So you as a patient would not be involved, which might be a factor, but something is better than nothing. And, ultimately you might want to go where there's more Waldenstrom's cases, which is the United States, which is 10 times as many as in Canada. But that comes with a cost.
Okay, and I think the answer to the next question is they can't do this. What if your doctor does not agree with the request for getting a second opinion? Look for a new doctor, or do
I would think very carefully about looking for a new doctor, because the conditions we're in now with lack of resources, and is even we often have issues we can't agree on with our partners and our friends, but we find some way to get around it. So maybe talk to your GP. I might talk to my GP to say, look, I'm running into a roadblock here with my oncologist. Do you have any suggestions for how I might be able to express myself better to him or her? Or can my GP help me get the second opinion? That's another resource if the referring oncologist doesn't. but I would make sure I tell that oncologist that I am still proceeding with a second opinion. And just, as I said before, be sincere. Say that this is important. I would say it's important for me to get this second opinion before I can give informed consent before proceeding.
Okay, and I think that's what's connected to it. If your doctor does not have any experience or knowledge with WM, can we request another doctor? It's kind of related to that.
It's kind of related to that. And requesting another doctor, I know with my experience with Hodgkin's disease, I wasn't just dealing with Hodgkin's disease. I was dealing with neuropathy. I was dealing with respiratory issues that arose as a result of the chemotherapy. There were even some cognitive neurological issues that came into play. So, it's a complicated decision choosing another doctor. I would say, we should consider where there are multidisciplinary resources, because there are going to be many issues we may have to deal with along the way. And so trying to get all those resources at one institution is a lot easier than going to many different ones piecemeal and then putting it together.
What if you have some knowledge about WM? You've attended lots of support group meetings, heard a lot of stories, and you know that your doctor is giving you a quote bad advice or a treatment that's not typically accepted right now. Again, do you say contact, get a second opinion? What we do? Do you know that something suggested to you is not correct?
Okay. If you're thinking that the information you got is not, first of all, doctors are obligated to follow standards. Okay, there's clinical pathways that they should be following. So I'm not sure if they intend to or err on the side of giving you bad advice. I would ask them, have they looked at all the options? Okay. Have they ruled out anything? And why do they think that is why they think that's the option for me? Yeah. I would never confront them. I would never go into a meeting with them with a stack of, printouts and say, look, this is what I found here and there. Just try to find out from them why they recommended the option they did as starters, and then work on that conversation.
Is there ever a time where it's not appropriate to get a second opinion?
Yeah, I mentioned some of those situations. For example, if it's topics that could be addressed in another format. So financial costs, or for example, musings about life and death, things like that. Maybe you want to consult a different professional. It's not appropriate to get a second opinion, in my view, if you've already started treatment. Okay, because by starting treatment, you've already given your informed consent. So if you have any questions or qualms about the treatment being proposed, it's really important to ask those to the oncologist or to your GP or to another resource before you start the treatment. That's when it would not be appropriate.
Okay, I'm just going to check the chat box. There's some comments there. See if there's a question. The clinical trials is there. Okay. No, that's just information for us. There's no more questions there. Anyone have a question for us? No, we're good. Okay, I want to thank you tremendously, Catherine, for speaking to us this evening. You have prepared us to navigate getting a second opinion because of your insightful recommendations. Thank you for all the strategies that you gave us. Example, your medical history script, having that ready, even your sheet on the ways to ask your approach in your doctor is very helpful, because I'm sure we can pass that on to people. And thank you for helping us become our own health advocates.
Thank you so much. It was a pleasure to speak to your group, and it's a long journey, and it will take time and effort, but with commitment, it's a lot easier. Thank you.
Betty, anything to say?